Pay attention to the effect of the herb no matter what herb you eat. I recommend that you try to find out its effect as possible. If what you don't expect happens, stop taking it whatever and consult a trusted expert. In addition to the above, here are more tips that any user needs for herbal treatment. Confirm the diagnosis. Some herbal freaks are dominated by the idea that they can diagnose the disease as well as choose herbal remedies. But diagnosis is a standalone art that only a doctor can practice. I do not encourage you to diagnose yourself. Diagnosis of the disease is not an easy matter, and sometimes a good doctor makes a mistake. However, the doctor's diagnostic cue was superior to that of any other person who did not receive a medical instruction. Once you are confident in the diagnosis, you can then ask the doctor about the appropriate treatment, medications, herbs, a combination of them, food, exercise, or lifestyle modification. Some doctors may focus more on food and lifestyle than medications in some cases. Watch for side effects. I am convinced that all medications, whether natural or artificial, have side effects. It is hard to imagine that an active phytochemical substance or a herbal mixture containing thousands of these substances targeting a single chemical reaction in the body. Of course, other reactions, unrelated to the origin of the disease, can be termed side effects. Some of these interactions are desirable, and some are undesirable. So you need to pay close attention to yourself when you first eat any new herb. If you happen to experience an unwanted side effect from your use of an herb, for example if you develop vomiting, desire to vomit, or headache, you should reduce the dose. Or stop using. Listen to your body. If you feel unwell from using a herb, quit using it. Beware of allergies. People can be allergic to anything. Even if you do not have allergy-related problems, you may be sensitive to a new herb. Be careful. Once the grass. Others. Listen to your body. If you experience any unusual symptoms, stop eating the herb and consult a doctor or allergist. If you feel any difficulty breathing within 30 minutes or something similar to consuming a new herb, food or drug, immediately call the emergency number. You may have anaphylactic reaction, which is one of the most severe allergic reactions and may lead to death unless handled properly. Anaphylactic allergic reactions to herbs are rare, and I do not mean to talk to you that you are intimidated by trying new things. Just be careful and understand the dangers of anticipation. Pay attention to interactions. Pharmacy drugs may react, bias, with one another or with food in a negative way. The same applies to herbs. Although many herbal books neglect this aspect. Always be careful when you consume more than one herb or when you take an herb alongside a pharmacist. Negative interference is still very likely. If you suspect any of them, consult your doctor or pharmacist. Here is one of the drug interactions that you should pay attention to. Antidepressant drugs known as the monoamine oxidase inhibitors MAOI interferes negatively with wine, cheese and many other foods. In the event that you take an MAOI, you should avoid these foods. The antidepressant plant St. John's wort is considered an inhibitor of the lemon enzyme oxidase, so it applies the same food caution. If you regularly take St. John's wort, consult your physician or pharmacy or consult a consumer's medication guide for foods to avoid. Open communication channels. Many people listen and follow the advice of herbalists. Usually no problems arise from this. For example, your doctor may prescribe sleeping pills to treat insomnia and a herbalist recommends a warm bath before going to bed with a mixture of soothing essential oils. However, just as food corrupts many chefs, excessive health counseling can get you right. Suppose, for example, that your doctor prescribes an MAOI inhibitor for depression, the herb of St. John's wort, then it may exceed your needs and suffer negative effects. Or, suppose your doctor recommends you take half a daily aspirin tablet to prevent heart attacks. and the herbalist recommends that you drink a daily cup of tea made from bark, willow or flat pie Canada tea. Experts will describe you as an expert. This tea will then contain chemicals that have the same effect as aspirin, which may lead to you taking excessive doses of the active substance and then to an anti-clotting effect that exceeds your need. In order to avoid this problem, make sure that your doctor and herbalist are aware of all your medications and any unfamiliar foods.